Welcome to St Vincent's Private Melbourne. My name is Ian Griswold. I am the CEO. We are honoured that you are considering our hospital for your treatment. Your wellness and safety is our top priority. St Vincent's Private Melbourne prides itself on personalising your care to achieve the best outcome for you. Please take a moment to watch this important video to prepare you for your hospital stay. Thank you for trusting us with your treatment and care.
When you're admitted, an identification band with your name and date of birth on it will be placed on your wrist. It must be worn at all times. To ensure you're receiving the correct care, staff must check the details on your ID band before giving medication or carrying out any treatment, tests or procedures. Any member of the hospital staff entering your room will introduce themselves and let you know what they are there to do. If someone does not introduce themselves, please ask them to do so. You'll be shown two remote controls. One of these operates your electric bed. The other controls your television, lights, and most importantly, is used to call your nurse. There is also a nurse call bell on the wall in all en-suites and bathrooms. You'll need to know how to call your nurse, so if you're unsure, speak up. For your safety, make sure your call bell is within your reach at all times. Located on your wall is a whiteboard for communication. At the beginning of each shift, your nurse will introduce themselves and write his or her name on the whiteboard. We encourage you and your family to write on the whiteboard. You can add the name of your primary contact person. You and your family can also write any questions or concerns you would like addressed by staff. For example, you may use it to remind yourself of questions to ask your doctor when he or she visits. Your safety is our priority. The best way you can help with your safety is to speak up if you have any questions or concerns. If you have any questions about your medications or side effects, speak up. If a tablet looks unfamiliar to you, don't take it until you've found out what it is. If you have any concerns about your medicines, speak up. It's important that you feel comfortable during your stay. You may not be completely pain-free. This is normal. We will monitor you to make sure the pain relief we are giving you is not making you excessively drowsy, dizzy, or nauseated. Please do speak up if you feel you're experiencing unwanted side effects, or your pain control seems insufficient. Your doctor can then consider prescribing different medications. If you're unsure on how to manage a sling, brace, or dressing, and you're going home, please speak up.
A hospital is a place with many sick people. It is important to prevent the spread of germs and infections. The best way to do this is by cleaning your hands. Anyone entering your room, including all staff and visitors, must clean their hands. They can either use the alcohol foam or wash them with soap and water. If you're unsure whether a staff member has cleaned their hands, speak up. For your safety and the safety of other patients, if your visitors are unwell, please ask them not to visit. They may call instead.
To keep you safe and comfortable, your nurse will check on you regularly throughout the day and night. When nurses are handing over information about your care and treatment plan, we encourage you to get involved. Ask questions and let us know if you have any special needs.
Clinical handover is where staff meet with you to discuss your plan of care for the next shift. This is an ideal time to let our nursing staff know if you have any concerns, suggestions or questions about your care.
Our staff are trained to notice changes in your health. You and your family can also help by letting your nurse know if you don't feel well, if you think your condition has changed or you think something has been missed. Use your call bell and speak up.
Falls are the leading cause of injury in hospital. Falls can cause serious injuries and long-term disability. To help prevent falling, do not walk in the dark. Turn on the light. If you have a walking aid, such as a frame or stick, always use it. If you're not 100% confident standing and walking, please call your nurse. Speak up. We may provide you with a pair of ruby red socks. These have a grip sole and also let staff know that you need assistance. Always remember, call, don't fall, and speak up. Your safety is essential, but we must ensure that our staff are also safe. Helping patients to move in an unsafe way, as well as repeated lifting, are the two leading causes of staff injury. To keep everyone safe, we use a variety of specialised equipment. To help you move yourself, you may be shown how to use equipment such as overhead poles and leg lifters. Because of the risks involved, staff are not permitted to lift you, including your legs back onto the bed. If you need staff assistance to move, staff may use equipment such as slide sheets, standing aids and hoists.
We want to provide 10 out of 10 care. If you have any concerns, we would like the opportunity to resolve them quickly. Please speak to your nurse. If you are unable to resolve your issue, please ask to speak to the nurse unit manager.
We look forward to caring for you at St Vincent's Private Hospital, Melbourne. For further information, please refer to our patient information book or our website.
We thank you for watching the video. On behalf of the team, we hope you have a comfortable and caring stay.